Welcome to Hey Dr. Sue. So people submit their sex questions to me anonymously, and once a week I post one question and one answer. Do you have a sex question you've always wanted answered? Go ahead and check out the description for information on how to submit it anonymously. This week's question is, how do lesbians get STIs? This is a great question and one we don't often talk about. When we talk about STI risk, we tend to focus on two populations, straight people and men who have sex with men. For women engaging solely in sex play with another woman, there is still a risk of STIs. Regardless of orientation, the amount of risk depends on what behaviors a person is engaging in. It also depends on whether or not they're using any kind of STI protection. If genitals are being rubbed together, then there is the risk of spreading things like herpes and genital warts. There's also the possibility of spreading any bacterial infections that might be present in vaginal fluid. These can include chlamydia, gonorrhea, and bacterial vaginosis, which we often call BV. If the women are engaging in oral sex and not using a barrier like a dental dam, then there can also be STIs passed that way. If you've never heard of a dental dam, it's basically a square of latex. You hold it over the vulva so that there's a barrier during oral sex. If you don't have a dental dam, which most people don't, you can always cut open a condom. If you're allergic or sensitive to latex, make sure you're using a condom that's made of something else, either polyisoprene or polyurethane. Usually the immediate follow-up I get to talking about condoms is someone asking why they would have condoms handy if they're a lesbian. In addition to the fact that you can cut it open and use it for oral sex, condoms are a great way to cover sex toys. Sex toys need to be cleaned and cleaned well to help prevent the spread of STIs. In addition to cleaning it, some people choose to use a condom on a sex toy to further reduce the chance of spreading STIs. And honestly, external condoms are often way easier for people to get than dental dams. The other ways that STIs can be spread is through hand or finger to genital contact. Make sure to clean your hands before and after sex play. If you see something funky on the genitals or hands, maybe a wound or something you're not sure about, use a latex or polyisoprene glove. It may not seem sexy, but it's a great option for preventing STIs. Regardless of your gender or your orientation, I would encourage you to talk to your partner about current STI status. You should also talk about how to protect each other during sex play and get tested for STIs if you haven't done so recently or are having any signs or symptoms of an STI. If you identify as a lesbian, keep in mind that some doctors will not always recommend STI screenings. Please, someone ask me about that so I can do a post on it. Regardless, you can always opt to get tested even if your doctor isn't recommending it. Until next time, stay safe and have fun. Did you like that video? If so, make sure to like and subscribe to the channel. That way you'll know when new videos come out. Also check out the description to find out how to find me on Instagram, Medium, and Twitter. And make sure to check the description for links where you can submit your sex question.